Critical limb ischemia is the most advanced stage of peripheral arterial occlusive disease. The problem with that is that it may lead to an amputation, which significantly affects the quality of life. And without revascularization, the risk on amputation is relatively high, above 20% even. When we look at the literature on SFA occlusive disease, most studies have focused on either patients with intermittent claudication or on mixed group of patients with intermittent claudication and some of CLI, but always the sample size of CLI were relatively low. And the consequences is that there's relatively little information on patients with critical limb ischemia. Well, the goal of this study was to look on the results of treatment with a drug-coated balloon, one particular type of drug-coated balloon, the Impact Admiral drug-coated balloon, specifically on patients with critical limb ischemia. And in that study, we tried to focus on the main outcome parameter for these patients, which is amputation-free survival. The study was a subgroup analysis of the Impact Global study. And the Impact Global study is a very large study that included over 1,500 patients globally. And it was a real world registry, so it included patients with several types of SFA occlusive disease. From that 1,535 patients, there were 1,416 subjects in the clinical cohort, and from them, there were 156 patients with critical limb ischemia, and these were included in the study. So what we observed in the outcomes was that when we compared the lesions of these patients with those that were treated for intermittent claudications, that the lesions were more severe. They had longer lesions, they were more calcified, and more oftenly the popliteal artery was included in the lesion. So it was a more complex and more diseased patient group. When looking at the outcomes, freedom from clinically driven target lesion revascularization rate was about 65%, which is about 10% lower as achieved in those patients with intermittent claudication. Within the group, eventually there were 4 amputations, 3 in the Rutherford 4 group and 1 in the Rutherford 5 group, which makes the limb salvage rate through 4 years 97%, which is relatively high. The most important take-home message is that by using a drug-coated balloon in patients with critical limb ischemia, a TLR rate of 65% can be achieved, and that is a remarkable high limb salvage rate through 4 years follow-up of 97%. We should bear in mind, however, that only patients with Rutherford 4 and 5 were included in the study and no patients with Rutherford 6, so additional studies are required. Well, the next steps should be a prospective trial that focuses only on patients with critical limb ischemia, including not only patients with Rutherford 4 and 5, but also those with Rutherford 6.